We'll move on to the next speaker, Dr. Diksha Datta, Pentoxifylline, a boon for ischemic neuropathies.
Good afternoon, respected judges and people. Today I will be speaking on pentoxifylline, a boon for ischemic neuropathies. Yes, optic nerve. Optic nerve is responsible for transmission of visual information from the retina to the brain. It is basically composed of axons of the ganglionic cell layer of the retina and continues up to the optic chiasma. It is basically a outpouching of the diencephalon and covered in meninges and bathed in CSF. Thus, it is not a nerve actually, it is a white matter tract or extension of the white matter of the brain. And arterial supply is derived entirely from the branches of the ophthalmic artery via the posterior ciliary arteries. Now, anterior ischemic optic neuropathy is damage of the optic nerve head, precisely speaking anterior 1 mm of the optic nerve, which is caused by alteration of its blood supply. AION as such is divided into two categories, mainly arteritic blockage with inflammation and non-arteritic blockage without inflammation. The first type is common mainly in old age group above 50 years of age in 5 to 10% and is responsible for 5 to 10% of AION, total AION cases. Non-arteritic occurs in younger age group and accounts for 90 to 95% of the cases recorded. Risk factor in the arteritic group, giant cell arteritis is a major risk factor. As for the non-arteritic group, sleep apnea syndrome, small disc, optic nerve head drusen, certain medications such as phosphodiesterase 5 inhibitors and then immunomodulator drugs are responsible, and autoregulation. People who suffer from nocturnal hypotension are more likely to get AION. Now, presently the treatment options are early steroid, high dose systemic corticosteroids are given. Intravenous methylprednisolone is mainly given at the rate of 1 gram per day for the first 3 days has been recommended. Other treatment options are monoclonal antibody and methotrexate. Now, focusing on pentoxifylline, it is basically a phosphodiesterase inhibitor which increases the cyclic AMP levels in the erythrocytes, endothelium, causing vasodilation. It also decreases the viscosity of blood, which improves circulation. It has immunomodulatory properties which results in vascular endothelium stabilization and autoimmune response inhibition. It decreases peripheral nerve injury by preventing free radical production by neutrophil inhibition and decreasing the level of cytokines. Studies have shown that pentoxifylline causes functional improvement in the visual acuity without causing any gross structural change in the optic disc. Our study design, it was a prospective randomized intervention study where we compared comparison of the visual function in AION patients treated with methylprednisolone only versus pentoxifylline combined with methylprednisolone. The setting was a tertiary care hospital in North India. It was a randomized prospective interventional study. The time period was from January 2023 to December 2023. That is a total duration of 1 year. Group A was given methylprednisolone alone, while Group B was given a combination of methylprednisolone with pentoxifylline. Inclusion criteria. Patients who were diagnosed with AION, both arteritic and non-arteritic, and exclusion criteria included known cases of diabetes, patients with other neurological disorders or any other pathological issues, patients less than 18 years of age. Now, diagnosis of AION was done based on visual acuity, color and contrast sensitivity, RAPT, disc edema, and in perimetry there is altitudinal field defect and pattern reversal VEP. So as discussed, Group A received 1 gram of IV methylprednisolone in 250 ml DNS for 3 consecutive days followed by oral steroids alone, while Group B received both the drugs. Oral pentoxifylline was given in the dosage of 400 mg BD for 90 days or 3 months. The parameters of comparison were visual acuity, color, vision, contrast, sensitivity and pattern reversal VEP. and they were performed pre-treatment on the 3rd day after completion of IV methylprednisolone therapy, 1 week, 2 week, 1 month and 3 months later. The results: unpaired student t-test was applied to compare the parameters between group A and B. Visual acuity or BCVA, as you can see, this is the logma visual acuity. The t-value was significant, the p-value was significant, and the graph shows the same. The vision gain was better in the second group. Similarly, in color vision also, the number of plates that the person could read in the Ishihara's chart increased was better in group B. The graph shows the same. Contrast sensitivity also improved. And in VEP, although amplitude was, the change in amplitude was significant, but the latency period was non-significant in both the groups. So finally, subjective parameters assessed in our study, BCVA, color vision and contrast sensitivity all had significant improvement in group B as compared to group A. Improvement in amplitude of P100 waveform in pattern reversal BEP was also statistically significant. Latency changes was non-significant. Thus, we conclude that pentoxifylline is a drug with multiple mechanisms of action which ultimately increases the ocular vascular flow. Supplementation of standard steroid therapy with pentoxifylline has a superior effect in recovery of visual functions, and pentoxifylline therapy results in reversal of latency and amplitude of P100 waveform close to the normal values. So, further studies on larger scale and greater data set and time period are required to testify my conclusions. Thank you.
I have a couple of questions for you. What dose of pentoxifylline did you use?
Ma'am, 400 milligram BD for 3 months or 90 days.
How many patients of arthritic and non-arthritic patients were in your series? Because you have used the umbrella term like all the AION
Yes, ma'am.
So how many arthritic were there?
Ma'am, there were 4 arthritic and rest like 8 were non-arthritic. 12, yes, ma'am. 8 were non-arthritic, ma'am. Mainly were non-arthritic cases. 4 only we got arthritic.
So is there any role of IVMP in the NAION?
Pardon, ma'am?
Is there any role of IVMP in NAION?
Ma'am, actually studies say that it does not produce any such effect, but then ma'am, in our center we used to give methylprednisolone. So we thought that because methylprednisolone as such was not producing any effect.
Your cases were randomized, one was arthritic.
Yes, ma'am.
You do not know which cases went on which
No,
side.
ma'am, we just did a simple randomization.
And arthritic has a very small window period in which the IVMP occurs.
Yes,
Maybe you were able to, you can save the other eye,
Yes,
not
ma'am.
the eye which has been
Yes,
affected. So how your results will be
yes, ma'am, that we did not do, we just randomized it like that.
Because in claudication also, in which the pentoxifylline is generally used,
Yes, ma'am.
it is said that it doesn't have a very superior role.
Yes, ma'am.
So I think it has to be taken with a pinch of salt.
Yeah.
Secondly, you just took 2 cases, one on the methylpred and other with methyl and pentoxifylline.
Yes, ma'am.
You should have taken a 3rd case where you have not given any treatment.
Placebo, yes, ma'am.
Because in NAION there is a self-resolution also. After the period of 3 months, 3-line improvement is Snellen chart
Yes,
is
ma'am.
noted. So there might be the patient who improved spontaneously.
Yes, ma'am.
How would you exclude out that possibility?
Yes, ma'am.
So I think you should have made 3 groups.
3 groups,
know.
okay.
And steroid did a very controversial role. It's not a very strong role over there. No, like it's not a well-established one.
Yes,
know. There are the people who are small series are there. He says it is very effective, but he has not done a control study also. So it's not a very scientifically good proof. So okay.
So thank you.
Thank you.